Today, we're going to talk about one of the oldest and honestly one of the most direct diagnostic tools that every single one of us has access to, and that's the color of our own urine. Yep, it's pretty much a daily health report. You just have to know how to read it. You know, for thousands of years, physicians have just visually inspected urine to get a snapshot of a patient's health. And this wasn't some kind of guesswork. It was a core part of medicine. And what's wild is that modern science is basically proving just how right those ancient doctors were. So just think about this for a second. What if you had this totally non-invasive, completely free daily report that could give you clues about your hydration, your diet, and maybe even signal some potential underlying health issues? Well, the punchline is you already do. It's reflecting what's going on inside your body every single day. So way back when, physicians would use this special glass flask called a Matula. They'd hold it up to the light to analyze, well, you know what. Today, of course, we have all these advanced lab tests, but that simple act of just looking is still an incredibly powerful first step. Okay, so before we get into all the warning signs, we've got to set a baseline, right? What does normal even look like? And the key to all of this is a pigment called urochrome. Urochrome is the star of the show here. It's a waste product that comes from breaking down old red blood cells, and your body kicks it out at a pretty constant rate. Just think of it as the yellow dye for your urinary system. Here's a super simple way to think about it. Imagine your body is always adding the exact same amount of yellow food coloring, that's the urochrome, to a glass of water. If you drink a ton of water, that color gets really diluted and looks pale or clear. But if you don't drink enough, that same amount of yellow gets super concentrated and it turns that dark amber color. And that right there is your own personal hydration scale. All right, now that we've got our baseline yellow figured out, let's explore the other colors of the rainbow. Because when your body deviates from that normal spectrum, it might be sending you a really important signal. Let's start with what's probably the most alarming color to see, red. Yeah, seeing red or pink can be pretty startling, but it's so important to know what it could mean, from something totally harmless to something much more serious. And this right here just shows you how sensitive this indicator really is. It only takes 1 milliliter of blood, that's like 20 little drops, to turn an entire liter of urine visibly red. Your body really doesn't need to shout to get your attention. So the crucial thing here is context, right? Did you eat a giant beet salad last night? Well, you might just be experiencing harmless Beeturia. But if there's no obvious dietary reason, red or pink urine is called hematuria, and that just means there's blood, which is always a reason to talk to your doctor. Okay, moving on to a darker, more serious shade. If your urine looks like dark tea or maybe even a cola, that's a signal that something more intense might be going on, either with your muscles or your red blood cells. A major cause for brown urine is a condition called rhabdomyolysis. It's a mouthful, I know, but basically it's when severe muscle damage, like from a crazy intense workout or an injury, causes muscle cells to burst. They then release this protein called myoglobin, which is actually pretty toxic to your kidneys. So how do doctors even tell the difference between muscle damage and red blood cells breaking down? It's actually a pretty simple blood test. They look at the liquid part of your blood, the plasma. If the plasma is clear, the problem is muscle damage. If the plasma itself is reddish, then it's a red blood cell issue. Pretty neat, huh? All right, next up is orange. This color can be a totally classic, harmless side effect to certain meds, but it can also be a really important clue that your liver and your biliary system are having a tough time. So the antibiotic rifampin, for example, famously turns all your body fluids orange. It's actually a good sign the patient is taking their medicine. But if that's not the cause, orange urine, especially if you have pale stools, can be a sign of a blocked bile duct. You can think of it like a plumbing problem in your liver or gallbladder, and that definitely needs medical attention. Okay, now these are the real unicorns of urine colors. Seeing green or blue is super rare, and it's almost always caused by something external that's been put into your body. So there's a specific kind of bacteria, Pseudomonas, that can cause a UTI that produces a blue-green pigment. But honestly, it's way more common to see it linked to medications like the anesthetic propofol, certain antidepressants, or even some medical dyes. Now for a color that looks incredibly alarming, but is actually just a fascinating and totally benign chemical reaction. Get this, it's called purple urine bag syndrome. It happens in patients with catheters when specific bacteria interact with byproducts of tryptophan. That's an amino acid from our food. It creates these cool indigo and red pigments. So while it looks super dramatic, the purple color itself is harmless. It's just a very vivid sign of a treatable UTI. And finally, we have the most dramatic and rarest of them all, black. This one's often linked to a rare genetic disease that was actually one of the very first of its kind to ever be discovered. The condition's called Alkaptonuria. With this disorder, the urine actually looks pretty normal when it's fresh, but then it darkens and turns black when it's exposed to the air. Over a lifetime, that same substance can build up in tissues and joints, and that can cause some pretty significant problems down the line. Phew, so we've seen this incredible spectrum of colors. But really, the most important part of this whole explainer is knowing when to turn your simple observation into action, a proactive step for your own health. Okay, so this is the real takeaway. If you notice a color change that sticks around and you just can't explain it, it's time to check in with a professional. And these 4 signs you see here, these are the non-negotiables. Any one of these should definitely prompt an immediate call to your doctor. You know, in the end, that ancient Matula flask has been replaced by modern science, but the principle is exactly the same. Your body is giving you data every single day. The real question is, are you paying attention? What's your body telling you today?